So, have you had a cranial nerve exam before? You have. So you know what's going to happen then, you know a little bit about it. Okay, and why have you been sent in for a cranial nerve exam today? Yeah, okay, that's fine. Yeah, just standard, so just to see how everything's doing. No worries. Okay, well, I will be the one conducting the cranial nerve exam today, so if you just want to take a seat, yeah, and then we'll get started. Okay, sounds good. So, to start, I'm just going to put on my gloves. Okay, we are good to go. So the first cranial nerve we're going to be testing is your sense of smell. Yeah, so for this one I've got a selection of essential oils and I'm just going to present that to you. You can smell it and just let me know what it smells of, okay? Sounds good. So I've got 5 different essential oils, okay? So I'm just going to pick one at random and we'll see if you can identify it. Okay, so here's the first one. Any ideas what that one might be? Yeah, it smells sort of like medically, doesn't it? Like, yeah, exactly, something you'd have when you've got a blocked nose. So what do you think that one is? Yeah, that one's eucalyptus. Good job. Okay, just going to make some notes of how you're doing, if that's okay. Yeah. Right, this is the next one. Okay, what does that smell like? Yeah, does it remind you of anything? Yeah, it's rosemary. Good job. That's a hard one actually, not many people get that. Okay, next up. What does this one smell like? Okay. Yeah, it's got a sort of festive scent, you could say. No, it's actually pine tree. Yeah, so it smells like a Christmas tree. Yeah. Do you normally get a real Christmas tree or a fake one? Yeah, me too. That's why I didn't really recognise the smell that well. Okay. I'm just going to take note of that one then. Okay. Right, next up. I like this one. What does this one smell like to you? Take a deep breath. Yeah, it's grapefruit. Yeah, I think you might be the first person I've ever witnessed to get that one right. Yeah, a lot of people say like orange or something, but no, I've never seen anyone actually say grapefruit, so good job. Okay, here's the last one. Okay, what does this one smell like? Does it smell familiar at all, or no? Okay, so this one's actually tea tree. Yeah, so if you've had nits, you might recognise it. No, that would be why. Okay. So that was quite a difficult one. It's not the most common smells. So we don't expect people to get 5 out of 5, so don't worry about that if you got a couple of them wrong. Right, so the next cranial nerve that we're going to be testing is hearing, okay? Yeah, so before we get started, I'm just going to get a swab and clean out your ears for you. Yeah, and the other one. Okay. Now we say we got a fair test. They weren't that waxy to be fair. So I'm just gonna, in one of your ears, I'm just going to rub my fingers, and I just want you to tell me which ear you can hear it in. Okay? Okay, cool. Good. Yeah. Yeah. Good. Okay. Yeah. Good. Yeah. And what about this one? Yeah. And this one? Yeah. Okay, we'll do a couple more. Good job. That was both. It was a trick. Yes, that was above. Okay. Good. Okay, perfect. Excellent. So, I'm just going to note down you got all of those correct. So, no issues with your hearing. Right, next up, we're going to do sight. So I've got a light that I would like you to follow. I'm going to do a few things with that. But before we start that, I just want you to put these glasses on to protect your eyes, okay? Okay. Yeah. Is that okay? Is it comfortable? Okay, so we're going to start with following the light, yeah? Okay. So just follow the light. 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 Okay, so I'm just watching where your pupils go when I move the light. So just keep following. Follow the light. 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 Okay, so that's good. Next we're going to do, I want you to tell me when you can no longer see the light, okay? Okay. Good. Good. Good, okay. Good. 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 Good job, okay. Good job. Good job. Okay, perfect. So that was also a success. Okay, and we have one more test that we're going to do. Yeah, so it's going to be the sharp or dull test. Have you done this before? Okay, so it should be no problem then. Okay, so I have this brush, and I'm either going to tap you with the brush side or with the back. Yeah, so just let me know which one it is. I'll just show you them first. So this is soft, sorry, and this is sharp. So sharp or dull. So dull and sharp. Okay. Okay, so just close your eyes, close your eyes, close your eyes, close your eyes. And just tell me which one you can feel, okay? Good job, that was dull. Yeah, sharp. Good. Yeah, good. Good job. Good job. That's good. Yeah. Yeah. Excellent. Okay. Yeah. That seems to be no issue for you, correct? There we go. Okay, so the sensitivity seems to be great. You got all of those right as well. Okay. So, I know we said one more, but I've got one more test. And this is again to do with sightedness, but it's your visual fields. So, I'm going to be using my fingers, and let me know when you can't see them anymore, similar to the light one, but just without a light. Yeah, you can take the goggles off now, actually. Okay. Good. 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 Good job. Good. Perfect. Okay, and now I want you to follow my fingers. So start by following this hand. Follow my hand, follow the fingers, follow the fingers, follow the fingers, these fingers over here. Now look at my nose, look at my nose, look at my nose. Look at my nose, look at my nose, look at my nose. Now look at my right hand. Look over here, look over here. Look at my right hand. Now look at my nose, look at my nose, look at my nose. Now look at my left hand, left hand, left hand, left hand. Over here. Now look at my right hand over here. Okay. Look at my nose, look at my nose. Look at my nose. Okay. You seem to be really good with that one as well. I'm just going to make a note. Okay. Right then. So, all of the cranial nerves that we've tested today have been good and working order. The only one that you didn't get 100% on was the scent, but that can also be put down to not actually knowing the scent, so then therefore you can't recognise the scent. Yeah, so next time, if there's a next time, we'll try with different scents. We can use some more common scents, and then there's a higher chance you're going to be able to recognise them. Exactly. Okay, well, I will forward a copy of this to your GP. Yeah, exactly. Yeah, then they can see it. And that will update on your record and everything. Did you want a copy of this email to you as well? Yeah, no worries, no, that's absolutely fine. Okay, well, I'll send a copy of that down to reception. You can pick it up there. Okay, excellent. Well, that is all